More than 2 million cases of COVID-19 have now been reported to WHO, and more than 135,000 people have lost their lives. While we mourn for those we have lost, we also celebrate those who have survived and the thousands of people who are now recovering. WHO is updating our guidance to include recommendations for caring for patients during their recovery period and after hospital discharge.
We will have this press conference in other languages, and therefore
WHO's position on wet markets. Wet markets, as you know, are an important source of affordable food and livelihood for millions of people all over the world. But in many places, they have been poorly regulated and poorly maintained. WHO's position is that when these markets are allowed to reopen, it should only be on the condition that they conform to stringent food safety and hygiene standards. Governments must rigorously enforce bans on the sale and trade of wildlife for food.
A lot of the preliminary information that's coming to us right now would suggest that quite a low proportion of the population have actually seroconverted. So it may not solve the problem. There's been an expectation maybe that herd immunity may have been achieved and that the majority of people in society may already have developed antibodies. I think the general evidence is pointing against that and pointing towards a much lower seroprevalence, so it may not solve the problem that governments are trying to solve.
We are aware of new numbers that were reported overnight from China, which added an additional 325 cases and 1,290 deaths from Wuhan. And this was done in an attempt to leave no case undocumented. What we understand is that they've used an existing law of statistics to find these cases. And what they did is they reviewed different databases. They looked at the database that is kept for all of the confirmed cases. They looked at their funeral service systems. They looked at hospital systems. They looked at laboratories to see if there were any duplications or if there were any cases missing. They looked for cases in fever clinics and hospitals, detention centers, and elderly care centers as well. And what they have reported is that the discrepancies in these cases were due to a number of factors. First is that the healthcare system in Wuhan was overwhelmed at one point, and some patients died at home. Secondly is that medical staff were delayed in reporting of these cases because they were focused on providing care for those patients and they didn't fill out the forms in time. Next is that there were additional locations that were built, and if you remember, in Wuhan in particular, some of the hospitals themselves were overwhelmed, and so they set up these makeshift hospitals that they called them, which were essentially stadiums and other facilities where they put mild cases to be cared for. And in those situations, the reporting wasn't done in a timely manner, and so those cases were added.
Afternoon somewhere, so see you at the concert, and I would like to use again